So this presentation that we're going to start off with is with UMR. They are going to be our administrator for our claims and for vision. So if you have any questions or after the presentation, then feel free to ask them. And like I explained before, we'll go till 11:50, and then we'll have to exit because the other presentation will be coming in. So let me introduce our guests this morning. We have Bonnie Clark. She's our strategic account executive. She's responsible for the development and maintenance of business relationships. She serves in a consulting capacity to ensure customer service and satisfaction and retention, as well as provides input into the design of customers' benefit plans. And we've been working with Bonnie a lot. She's been great to work with as we try to convert over from our current vendor. She serves as the voice of UVU within the UMR system and directs all the activity. With her today is Cassidy Stevens. She's our client service consultant. She's responsible for the day-to-day account management of UVU. She ensures UVU's core needs match that with UMR's. She's earned a communications degree from the University of St. Thomas, and she moved from Minneapolis to Utah to begin her career with UMR last July. So with that, we'll turn the time over to Bonnie.
Thank you, Judy. Good afternoon, or I guess it's morning still. Just a show of hands, how many of you were at the health forum? Did you see that presentation? Okay. A lot of the slides that we're going to talk about today are similar to what we talked about at the health forum, and I'm going to go through them pretty quickly so that we can get to the real meat of this meeting, and that's really the demo of our website. So it's more of a hands-on type of experience. And we're also going to show you the tool called My HCE, My Healthcare Cost Estimator. And I think you're going to get really excited about the ability to look up your providers and what they're charging. So let's go ahead and get started. Cassidy? Oh. Okay. First of all, welcome to UMR. We're happy to be your administrator for medical going forward, and we'll go ahead and talk to you about, it's not working? No. Okay, this isn't working. Sorry about that. So today's schedule, we're going to actually go through the benefits programs that we're offering, and we had talked about these at the health forum. We're going to do the demo of umr.com, and then we're going to wrap it up with what else you need to know. Some just housekeeping items. So let's go ahead and get started. We'll start with the benefit programs. The first one we're going to talk about is the vision benefit. This is actually a voluntary product. You are not required to enroll in this if you want medical. It's a separate election. It is administered by United Healthcare. It does cover, it consists of 53,000 providers, and the mix here is 50% of private doctors and 50% of your national chains. So like your Walmart, your Optivision, your Costco, Sam's Club, etc. Okay, so that's your vision. We are also offering the Employee Assistance Program, and this is through Optum. And Optum is a sister company to UMR. And the Employee Assistance Program is to assist you in any issues that are coming up. For instance, like marriage problems, or if you have problems with children, you can talk to a counselor that will help you through the issue. It's unlimited telephonic counseling. If you want face-to-face, you have up to 5 visits free of charge. And the nice thing about being with Optum is that the doctors that you're going to visit with are the same doctors that are on the UMR network. So it's a really nice transition if you're working on an issue. It's going to take more than 5 visits. You can transition easily into your medical plan. Okay? Teladoc. Teladoc is a separate company from UMR, but it is offered through UMR as a 24-hour, 7 days a week service. What you can do when you first sign on to Teladoc, It'll ask you to complete a health statement. It's just like going to a new doctor. You have to fill out a statement saying, what are my allergies, things like that. Once you sign up, complete that form, then a doctor will call you back within 20 minutes, and you can talk to the actual physician. It's a qualified credentialed physician. They can talk to you on a Skype or on your phone or just telephonically. They can do some prescriptions. So if, let's say you have a child, it's your 4th child, you know it's an ear infection, you don't want to go see the doctor, it's 3 o'clock in the morning, call up Teledoc, they'll actually order you a prescription. You can go to the pharmacy, pick it up, and you're done. Okay? It's a time saver. So UMR has access to United Health Network. And what this means is that you have over 720,000 hospitals, or physicians, almost 6,000 hospitals that you have access to throughout the country. It's a national network, so if you're on vacation in Minnesota, or if you're home here in Utah, it's the same network all across the board. You will have an ID card that will have your network name on it, and it will get you to any of those in-network providers. You will have access to 2 separate networks. So the green plan will have 2 networks, the white plan will have 2 networks, and the high deductible will have 2 networks. So Choice Plus is the first network, and that includes all of your Intermountain healthcare providers, your facilities, so LDS Hospital, Utah Valley, all the Intermountain healthcare facilities. The Options PPO includes those same Intermountain healthcare facilities, but it also includes the University of Utah, Jordan Valley, Pioneer Valley, Salt Lake Regional. So Options PPO is a little broader than your Choice PPO. So when you're making your election, keep that in mind, okay? So we're going to talk about now the UMR products. And the first one is the care management. And they're really there to help you with any hospitalization that you have. When you call in for pre-authorization, you will be put into the system. Someone will reach out when you're in the hospital and say, how are things going? Is there anything we can help you with? We also work directly with your doctor to make sure that your treatment is within the range of your medical benefit plan, that they're not doing something that might cost you some money. After you're released from the hospital, they'll also arrange for some type of home health care if you need that, and it would be covered under the plan. The other program that UMR offers is called Disease Management Program. If you have one of these 7 conditions, you will be assigned a coach that will help you manage your condition better. What you need to do, on the next slide, is you would just call into our customer service line, the disease management, care management line. They would ask you a few questions about your current condition, where you are, and then they would start setting up some meetings with you, just some coaching online. And if you enroll within the first 90 days, and you complete that initial assessment, and you participate in the coaching, at least 2 coach calls, then we will send you a $100 gift certificate. And the reason we do that is we want to make sure that you're getting the best care for your disease. These conditions are pretty serious conditions, and we just want to make sure that you're navigating through the system and that you're able to get the treatment that you need.
Do we have to wait until July 1st?
You do. Yeah, the question is, you have to wait until July 1st. All of these programs will be up and running by July 1st. So you do have to wait.
Is that an additional charge?
Nope. Nope, there's no charge for any of these programs we're talking about. Yes?
You're working with a health care specialist that's over your specific disease condition in the chronic category. What additional things are they going to do for you that a specialist in that area isn't going to do? I wouldn't anticipate that same knowledge base that they would have?
No, you are working, and it's, the question is, what additional services will our coach provide? It's really working with your specialist. Let's say you have a question about, let's say the doctor wants to refer you to a dietitian or nutritionist. What our coach will be able to do is help you schedule that appointment, get you into someone that's in network, things that your doctor probably wouldn't take the time to do, to check your benefit plan and see how it's covered, explain your benefits. That's really what that person is. It's really your own personal concierge.
My question would then be is, if I'm going in for nutritional counseling as a diabetic, and the doctor already has a dietitian on their staff, is that going to be a covered benefit or not?
Yes, I mean, anything your doctor's doing, that takes priority over our coaches. Our coaches they're not there to take the place of your physician, they're there just to assist you in your treatment. Just to answer questions that maybe your physician hasn't answered or assisted you with. They're really there to help you navigate through UMR too. Okay, and UMR offers a nurse line, 24/7 nurse line, and this is, let's say you don't want to call Teledoc, you just want some advice. Let's say you went to the doctor and the doctor says you have this condition and didn't take much time, didn't answer all of your questions. You can actually call up the 24-hour nurse line and say, I just met with my doctor, here's my condition, can you give me a little more information about this? You are talking to registered nurses and they'll educate you on any type of treatment or suggest treatment, maybe that you go see your physician and get you hooked up to a doctor. They're there 24/7, so call them day or night. That is included, no additional cost on this one. And we're also offering a maternity management program. And what this does is, even if you're not pregnant now, if you want some counseling with a nurse about getting pregnant, or if you're having trouble getting pregnant, you can call up the maternity management program and they'll walk you through some programs that might assist. If you are pregnant now, you can enroll in this program, voluntarily enroll, and you will have a coach for maternity reasons. So, if it's something that you're unable to reach your physician, you can always call up your maternity management coach and they'll walk you through any of those, answer any of your questions about maternity. When you enroll in this program, you will get a book, a choice of different books, like what to expect when you're expecting. Once you complete the program, and they've done an assessment to see if there's maybe some postpartum depression, to help you walk through that. Once you've completed that program, they'll send you a $25 gift card, and I believe it's to Target. So it's just your thanks for participating in the program. What we're finding is at the bottom of that slide, it says half of the babies born under the program are half as likely to be premature, and the costs are half of what a birth would be if you're not enrolled in the program. So we feel that it's a very good program to enroll in. So UMR will also be working very closely with Judy and her staff on developing a health and wellness program. As of July 1st, you will actually be able to go out there and complete a clinical health risk assessment, which tells you maybe some of the areas that you need to focus on. It may be diet or exercise, give you suggestions on what you can do to improve your health. It'll have educational material, wellness tools. You can actually go in there and create an action plan, depending on what your clinical health risk assessment comes back, what the results are. And we'll also send out quarterly newsletters on some health-related topics. So the excitement that we have is now we're going to demo what's called My Health Cost Estimator. And this is where we had talked about in the forum where you can actually get the provider's prices based on our contracted rates, and you can price out your services. So if you're going to have an MRI, you can go in there, check all the different providers that provide that MRI and pick which one you want to go to, and it'll show the price for each. So we'll go through that, and it'll be surprising. You'll be, I think, pleased to see what you find. So we'll go ahead and jump into UMR.com. This is our landing page. This is what you'll see. And we've made it easy at the bottom there to navigate through the system. This is a brand new homepage, so bear with Cassidy and I. It's only been out, 3 days? So, but it has the same stuff as the old site. It's just how it's formatted. So let's go ahead and get into Health Cost Estimator. Oh, logged her out. Sorry about that. Technical difficulties. Are there any questions while we're logging into this? Yeah.
On the Teladoc,
Yes.
is there a charge for that?
Oh, there is, actually. Yeah, I'm sorry about that. Teladoc, there is a $40 charge for that phone call consultation. However, if you're on the PPO plans, the green and the white plans, the copay is going to be $20. The university is actually picking up the other portion of that $20. If you're on the high deductible health plan, you will have to pay that $40 until you meet your deductible. That's just one of the regulations for a high deductible health plan, that you meet the deductible first. Once you've met that deductible and you call in, then you would only pay the $20 copay, and the university will pay the other $20. So thank you for bringing that up.
But the Ask a Nurse thing is free.
Ask a Nurse is free, yes. Any other questions? Yes.
My wife has is receiving a medical treatment, a monthly medical treatment that had to, through EMI Health, we had to go through an approval process to, for them to approve this.
Yes.
But it's a monthly thing, so when can I start getting that approval process going so that July 1, we don't have to start it then and then have her medical treatment delayed until the approval process is complete? Can we start that before July 1?
You can. Actually, what we're going to do is we've asked EMI to provide us with all the current pre-authorizations they have on file. And if you have already scheduled a surgery, we're asking for all of that, the pre-authorizations for all of those too. So come July 1st, we're ready to go.
So there's nothing between now and July 1st that we need to do or can do to make sure that it's up and running? Because this is a treatment that if is delayed, can cause some serious problems.
Yeah, we have, it's called transition of care, and there is actually a form that you can fill out, and HR will have that form, and we'll just assign you a nurse and get that process going.
Okay, thank you.
Yeah. Yes.
Are there, do you have to go through a primary physician to refer to a specialist like a physical therapist or something, or can you self-refer if you know, and just go to the doctor?
Yeah, the question is, do you need a referral to go to a specialist? You do not. You're free to go to any physician on the network, or even out of network if you want it paid out of network. But yeah, no, referrals are not required. Yes?
How do you work with
TRICARE.
TRICARE?
TRICARE is primary if you're military,
I'm
Ex-military?
So TRICARE is secondary.
secondary.
So you guys would be primary and they would be secondary. You guys hand off between the two and work that out?
So if we're primary, I'd have to look at your benefit plan. So if we're primary, then we would just pay according to the benefit plan, and then we would send you an explanation of benefit after we make that payment, and you just have to provide that to TRICARE. I don't believe we have an interface with TRICARE to just forward that to them. TRICARE is actually a United Healthcare. It's being managed by United Healthcare, so that's interesting. Was EMI doing that?
Yes.
sending it directly to TRICARE for you. We'll have to look into that and see. But the coordination of benefits will work the same way as it is working now. For those of you who are dual covered, the same thing will occur. We've confirmed that with EMI on how they're doing it. We're going to do it the exact same way. Are you up? Yay! Okay, she's been working on this behind the scenes. Okay, so the first thing it's going to ask you is what your zip code is. So you can use this no matter where you're at. You can have a student off to school in New York and they can pull up their zip code and do the exact same thing we're going to do now. So she put in 84095. Get started. You have to agree that it's, you know, our legal disclaimer. To the best of our knowledge, these are our contracted rates. So you're going to say, let's go ahead and do back pain. So it's going to pull up all the different episodes of care. And it's going to say, what kind of back pain, what do you need? And let's say you're going to have a discectomy, lumbar discectomy. And it's going to say the health, based on your benefit plan design, it's saying that the total estimated cost in network for a laminectomy, or a discectomy, I should have gotten one that was easier to pronounce, discectomy is going to be $18,000. Of that, the health plan will pay $13,000 of that, and you would be responsible for $4,686. Okay, so that's just kind of a general statement of what it's going to cost. So you say, I really want to personalize this. I want to find exactly how much I'm going to pay and who these providers are. So you're going to personalize your estimate.
Question?
Yes?
Is this going to be live and be able to pull, for example, from a high deductible, when we've met a portion of the deductible, is this going to take that into consideration, how much we've met?
Yes. At the time you pull this up, it'll check your deductible, where you're at with that. It'll actually show if you have a $20 copay, all of that, all the benefit designs are going to be in here. So it's really live data you're getting. Okay, so what it's going to do, now you're personalizing it. And the first thing you're going to say is, okay, I need to find a specialist. So go up to the top, Cassidy. So office visit with specialist for evaluation. Let's start there. So what it's going to do, it's going to list the doctors that would provide that service. So it's pulling up orthopedic surgeons. You've got Dr. Rosen, you've got Dr. Fukushima, and you can see that this physician, the average charge, or the local charge is $320. This physician, our contracted rate is $212. So that's what it's going to, that's the cost of that office visit. And if you scroll down, let's go until we get to, go to the number 10. And all of a sudden they turn red. They went from the green numbers to red numbers. Now they're above the local average. So we're going to put you can actually sort it by cost or by premium designation, those doctors that have gone through some quality and cost measurements. So they appear at the top. But when you get down to the bottom, so it was what, 218 for that first doctor? Now we're up to 586 for this doctor. So it makes you a better consumer. You know, you don't always want to, maybe you don't want to always go with the cheapest, but, you know, it does give you the opportunity to look at the different providers and determine what your cost is going to be. So let's go back to 1, and let's go ahead and pick Dr. Rosen. And he is a tier 1. They will always appear first, and tier 1 just means that they have gone through, they're a preferred provider for United Healthcare. Okay?
What is that preferred based on?
That means that their practice, let's say, they don't do unnecessary tests. So some doctors you go to and they say, we're going to order all these tests. This type of doctor is very cautious of, let's try this one. If that doesn't work, let's try this one. Instead of saying, let's do all of them all at once. So they're looking at the type of care they give. They're looking at, are they referring you to in-network labs? What's their cost of service? Is it reasonable or is it really high? I mean, what are their billing practices? So they look at everything, the employee's experience, and they say, we like what you're doing. We like your office. We like the way that you practice medicine.
Do you look at outcomes?
Outcomes, quality of care, readmissions to hospitals, things like that.
What about if they're board certified or use best practices? Do they take that into account?
They're always evaluated by their peers. So it's not just,
necessarily a board certified position.
I don't know. I know that to be on the network, you have to go through some credentialing. So I don't think you have any problem with any of the providers. It's just the ones that they've evaluated will appear first as a tier 1. So I'm not sure what criteria, other than, if it's board certified reviews or not, but after we pick the specialist, let's say, most likely you're going to have an MRI. So that's the next thing that comes up. And look at this, Western Neurological Associates, $473 for that MRI. And as you go down, Utah Valley, let's go back up to Utah Valley, $724. And again, these are our contracted rates. Same MRI machine, maybe one is newer than the other and they need to pay for that machine. Well, the other one's probably paid for. But here, you could go for the $473. If you're on the high deductible health plan, this means a lot. It's out of your pocket.
Okay, but I'm looking at this and it says on here, health plan pays 0. If you go down to the more expensive one, the health plan pays for part of that. Why is that?
Because this is probably a high deductible and it went to your deductible. And then when we get to here, now you're meeting part of the deductible because it's a higher cost, and now we're paying 80% after that. Does that make sense?
Okay.
So the lower amount's going towards your deductible. Okay?
Either way, you're paying more out of your pocket.
Right.
Yeah.
I had a question about in-network. Does the facility and physician initiate getting in-network, or is it like, for example, if you have a specialist that you're working with who's not in-network, can they go through a process to be in-network? Does it come from the doctor, or does it come from you?
The question is for out of network, how do we get them in network?
Right.
There is a form, and HR has the form, and you can just bring that to your doctor and have them fill it out and send it to United Healthcare. It's really up to United Healthcare and between the doctor and United Healthcare. United Healthcare will send them a contract and say, do you agree to these rates? And then they negotiate those. And if they don't, then they don't get added. Or if they fail the credentialing process, then they're not added either. So you can do the best you can to get them nominated and get them in the system, but you can't determine the outcome. Okay, so we're going to pick Western Neurological Associates. And you wouldn't think that's in network because it's right across from St. Mark's Hospital. St. Mark's is not in the network. So I thought that was interesting. There's a note here that says the surgery you're going to have does require anesthesia. We can't estimate the anesthesia because it's based on time. And that's just really what that's saying. Okay, so the actual surgery. This is at the hospital. Looks like IMC is the only one that would do that.
For the doctor.
Oh, for that doctor. So the doctor is allowed to do the surgery at that hospital. So Intermountain Medical Center in Salt Lake City, the facility is $15,000. Local average is $16,000, so you still are saving some money there. The health plan, now you've met your deductible and starting on your 80-20 split there. And your out-of-pocket is $3,783. The plan pays $12,000. So you're going to select that facility. Okay. So after your surgery, you're going to have physical therapy. So now we're going to pick our physical therapist. And you can see the ranges. This facility, 505, and it's going to go up, yeah, it can go up to 1,846 if you took it to the very end, what it would cost. And you can just scroll down and you can pick the facility. And what we do at the very end of this is you can save this path that you've gone through, and you can actually take it to your doctor and say, this is what I've come up with. You know, what are your thoughts? Do you feel like this rehab place is the place for me? I mean, it's gonna, when you take it to the doctor, they're gonna be really surprised that you have everything in front of you. But this is what it does. Yes?
Do we have any out-of-pocket maximum?
You do.
That after that level, then they were at?
Yes, and as soon as you've met your out-of-pocket maximum based on which plan you decide, it'll show 100%. So it really is based on your actual, what you've met at that point in time. Yes?
Most of what I'm seeing come up on this is north, Salt Lake area in terms of comparison. I live way down in the south end of Utah County. I'm seeing hardly anything come up. Is there very little?
Yeah, it's the zip code. Whatever zip code you put in will get you there. But you may have to scroll a couple of pages to see that, but it is, all of them are in-network doctors, so you may have to search a little bit. Yes?
If you've seen an in-network physician, and then when you go to do surgery, the hospital that they're attached to is out of network, is there that scenario possible?
Could be, and be really careful, because that's going to be expensive. So what you might want to do is, if you're seeing a physician right now and you're planning a surgery, you might want to ask them if they have admitting privileges at one of the Intermountain Healthcare facilities. If they don't, you might want to ask for a referral to someone else. We do cover out of network, but it increases your out-of-pocket costs. You're free to go anywhere, but I would make that recommendation. Okay, so we're going to select Salt Lake Orthopedic Specialists. And you're going to have a follow-up visit. Again, we're probably going to pick the same doctor, Dr. Rosen. And your final estimate. It's going to take you 4 months probably to recover. It's just an estimate of how long it's going to take. Total cost now is $17,000. The UVU is going to pay $12,000. Your out-of-pocket is $4,501. So now you've customized that for you based on your selections. And then it walks you through what you've selected. You can print or you could save. If you wanted to go back and change the doctor, let's say you meet with your doctor and he says, no, I don't want, he or she says, I don't want you to go to that physical therapist, I prefer this one. You go back in, select that physical therapist, and now you've got your estimate there. Okay? So, is it exciting? Is it nice? There really is no other carrier out there that's willing to show you what the prices are. This is very unique to United Healthcare Network. We just want you to be better consumers. Any questions on my HCE, my health cost estimator? Yes?
Can you show zip code 84651?
84651? Sure. What zip code did we use?
095.
So West Jordan or something like that.
We need to put enough.
Okay,
Oh, right there, right there.
you start with
Okay.
What was it?
84651.
84651.
84.
Oops. I'm in California.
That's,
South. Maybe a broken leg or something.
there you go. Is that better? Dr. Grover, Dr. Peterson, David Peterson, Scott Peterson, Maynard Olson. Those sound familiar?
Yep.
Okay. Yes?
Can you get online now and check the facilities?
You can't. The only way, and we don't release this to the general population because you can see the problems this would create. We only allow members of United Healthcare or UMR to access this. It's proprietary, only our members have this product. So once you get your ID card, then you can actually sign on and you'll have access to this at that point. So we're estimating probably mid-June, you'll have your ID card and your member ID number. We don't use social security numbers on the card, just your member ID number, and that's how you register and get on here. So you're special because you're members. Yes?
I have a daughter on a mission in Uruguay. She needs medical help. How do I get to her?
Uruguay, we don't have a network there. So what you need to do is you need to pay it up front. We can't send payments outside of the U.S. So you'd have to pay for any treatment that she has and then submit it to us for reimbursement. If it's an emergency, if it's a life-threatening emergency or just any type of true emergency, then we'll pay it as in-network. If it's just for maybe a sore throat or something like that, we'll pay it as out-of-network. So it's just true emergencies that are paid in-network. But we will reimburse you.
I have a son who's going to college in Washington State. Looks like that's in network. He can put in his zip code because it looks
Yeah.
like from the map.
This is a national network, so no matter where you are in the U.S.
So that's not been the case.
It hasn't been the case in the past. That's what's good about this is it's across the country. We're one of the largest networks. So you have access no matter where you're at in the U.S. And what's nice about this is your student away in Washington can pull up their physicians right in the network and do the exact same thing.
Right.
Yeah. Oh, I'm sorry. Yes.
About out of network, let's say you had a problem and you go to Payson Hospital.
Uh-huh.
It's not covered, it's out of network. Do you have to leave there when you're stable, or can you stay there the entire time?
If it's a true emergency and you go to an out-of-network hospital, actually we'll be paid as in-network. As soon as you are stable, we'd like to get you there. That's where your case manager will be really helpful to say, what other options do I have at this point? I'm now stable, or you can work with your doctor and say, yeah, let's go ahead and transfer him to this hospital. But typically, once you're stable, we want you to go to the in-network because of the savings. But emergency, go to the first place that you come across. Don't worry about in-network, out-of-network if it's an emergency. Okay, let's go back to just the website, and I just want to show you a couple of things. Find a provider. See on the left-hand side, we've had a lot of questions. We're down in the Hall of Flags. A lot of questions about how to find a provider. That's where you would go. And it actually brings you to the United Healthcare Provider Search. And once you're registered, you don't have to tell it what network. It'll already pull it up. So this demo is United Healthcare Choice Plus. If you have options, it'll say Options PPO. You don't have to select which network to look up. And then you can view your providers. Yes?
Is this something that we could do prior to June, so we can look up and see if the doctor we're currently meeting with is covered, or is it part of the quicker effort?
Yes. The question is, can you look up your providers now? Go to umr.com, and it says find a provider, and then it'll ask you what network. That's the only thing that's different, is you'll have to know Choice Plus, United Healthcare Choice Plus, or United Healthcare Options PPO. And then once you're there, once you pick that, then you can get in the same site that we just went to. Yes?
Will all of our family members log in the exact same way, or does each family member have a separate login?
If you're over, no, it's the same member ID, but if you're over the age of 18, you have your own separate login. If you have a child that will allow you to review their records, they have to give you authorization as the employee to look at their information. Yes?
I went onto that site and I noticed that when you pull up a doctor, there's some footnotes about whether they meet your criteria for cost and also for quality.
Uh-huh.
And there are actually doctors on there that I interpret are on the network where it says they don't meet it for quality and a lot of them do meet it for cost. Can you tell us how to use those footnotes? Does it change what we do?
Well, when you do the search of providers, of course, tier 1 are going to come up to the top. Those are our preferred. All of the carriers or all of the physicians that appear on that lookup are in network. And sometimes there's not enough data. Like we did this demo up in Wyoming, and all of them came up non-preferred. Well, there's just not enough information for them to evaluate if they're tier 1. If they provide, if they always refer to in-network labs, how their practice is, complications, things like that.
But if we pull up one of our doctors and on that it will come up and say, doesn't meet quality standards, what does that mean to us? It's in that little more about this provider link.
Yeah, and can you click on that and it'll,
Yeah, and you'll see what I mean. I didn't know how to use.
click on the link that says,
Will say,
no, the quality and cost.
quality and cost efficiency.
Yeah, go down to that link right here.
Yeah, annoyingly, it does always kind of come up out of the window.
Oh,
That's the secret.
right there.
Yeah. So what do we do if it says they haven't met guidelines? Does that affect how you will pay it? Does it?
No, it doesn't affect any payment at all. It's just saying they haven't been evaluated or they haven't passed the process of going through that qualification. Doesn't mean they're bad providers. Don't take it as that. They wouldn't be on the network if they were bad providers. So, yeah.
If we're on a high deductible plan where the medical and prescription are the same deductible, is your system connected to the Envision RX system real time so that it'll know what we've paid and not end up charging us extra on one end or the other?
Yes, we're connected. We're sharing that data on a daily basis, so we'll have information going back and forth. Whatever you meet under medical will go to the pharmacy vendor. What's under the pharmacy will come to the medical, and it'll be coordinated every night. Yes?
How do you guys deal with like when you have to prepay for like a surgery? Like I had a surgery last year where I had to prepay the doctor so much money, and so that didn't get applied to my deductible. And then when you guys paid, you had no record of that money being paid.
What I would suggest, there are sometimes when you go into the doctor and they say, we want you to pay this up front. Don't pay up front. I mean, the best thing, because you don't know what the discounts are going to be unless you've looked them up. But you want that claim to be processed through the system before you pay it. If they ask you to pay it, give them a copay. Give them $20 or give them $50. Don't pay the whole thing.
You don't get the surgery.
Pay it or don't get the surgery?
Yeah.
Yeah, because I don't, I'm not sure, I'd have to look up the contract with United Healthcare. I don't know how it was with EMI, but United Healthcare, I don't think they require, I think that's part of the contract, they can't require you pay everything up front.
Yeah, it wasn't everything, it was just a portion.
Yeah.
And that just didn't get applied to my deductible.
Yeah, if the doctor submits the full charge to us, we'll of course take the discount and apply that full discounted amount to your deductible. We won't care how much of that you've paid. already, we'll apply what should apply based on the contracted rates. So I'm not sure how that was handled before, but we'll give you credit for the full cost of that surgery or what it would cost you. Any other questions? Anything else? Oh, yes.
I have a question, with the vision plan.
Uh-huh.
Well, on the medical, under the green, it said that, you can get no copay vision, once a year vision, checkup.
Uh-huh.
And have no copay.
Right.
But then on the vision plan, it says you get your once a year, you have a $15 copay.
Right.
How does that work when you're at your provider for your eye exam? Do they say, well, we'll do this under medical and then your vision plan for the checkup, and then, I don't know.
Yeah. The question is, you've got a $15 copay under the vision, but it's paid 100% under the medical for the exam. You choose. So if you want to go, if you want it paid under the medical plan, go to one of the providers under the medical lookup. If you don't want to run through the medical, you go to the vision provider and you pay the $15 copay. So you're free to go wherever you want to go. I mean,
Would it be two different providers? Or
could
is it
be.
not the same
No, because our network doesn't include Costco and Walmart and all of those providers. The private doctors may be in our network, may not. It's totally the vision network is different, separate from the medical network. Yeah, so you choose which one you want to use. Okay, we're about 10:02. Okay, we'll just take one more question then.
I'm trying to find on your site with the providers, because you say you cover like IHC facilities, but what about Instacare facilities?
Yes, Instacare, sorry. Instacares are covered.
There's like two.
In this area?
Like IHC, I'm only seeing, like for Utah, there's like 2 of them.
There should be more. Did you search by urgent cares?
Yeah, I did urgent care and all of Utah.
Yeah, it's all of the Instacare. It's all of the Instacare facilities, so you should have plenty. I'm not sure about what you have around here, but it's all the Intermountain Healthcare facilities. About 8 of them?
Well, what do we do if those aren't showing up? How do we?
We'll look at yours afterwards.
Yeah, come down and we'll talk about that, but if it's Intermountain Healthcare, it's in network. WorkMed, I don't think so. We'll have to look that one up for you.
That's IC too.
WorkMed, I'm not sure if that's Intermountain. Okay, well, thank you very much for coming in and meeting with us today. Appreciate it.